Dear respected guests and colleagues, welcome to Words of Inspiration. Today's session is titled, Why Period Pain Hits Hard, Islamic Medical and Mind Fixes Women Menstruation. A gentle start, understanding your body's rhythm. Welcome, dear sister. This is a safe and gentle space for you. Menstruation, or Haid, is a natural part of a woman's life. Yet many girls reach their first period without being adequately prepared for what will happen to their bodies, their emotions, or their Islamic responsibilities. A girl should ideally learn about menstruation before menarche, the first menstrual period. Periods commonly begin around puberty. The NHS notes that the average is around age 12, although they can begin earlier or later. She should understand beforehand what menstrual blood looks like, and how to use pads or other appropriate menstrual products, basic intimate hygiene, and how frequently menstrual products should be changed. That abdominal cramps, backache, tiredness, and some emotional changes can occur. The Islamic rulings concerning Salah, fasting, and ghusl. How to record the beginning and end of each period, particularly because this can be important in Islamic jurisprudence. That she should never feel ashamed to ask a trusted parent, knowledgeable female teacher, doctor, or qualified scholar for help. We are here to talk about something many women experience every month. We will discuss the monthly cycle, often called a period. This is a natural and important part of being a woman. It is a sign that your body is healthy and working as it should. Sometimes, this monthly visitor brings pain and discomfort. This can be hard for your body and your heart. It can make daily life feel very difficult. You are not alone in this experience. Many women around the world share this journey with you. This conversation is important for your health and your faith. Your body is a trust from Allah, and taking care of it is a form of worship. Understanding your cycle helps you care for this trust and find peace and comfort, even on difficult days. Allah's wisdom, faith, and your monthly cycle. In Islam, menstruation is seen as a natural part of a woman's life. It is not a curse or a source of shame. Aisha, may Allah be pleased with her, said, "This is a matter that Allah has decreed for the daughters of Adam." During menstruation, some acts of worship change. A woman does not pray, and she does not fast during Ramadan. This is not a punishment. It is a mercy from Allah. Make dhikr. Listen to the Quran. Make dua. Give charity. Your intention to pray is still rewarded. Classical scholars like Imam an-Nawawi explained, it is not permissible for a menstruating woman to pray or fast. This guideline provides ease. Closeness to one's husband remains. The only restriction is sexual intercourse. Affection maintains the bond. Modern Muslim scholars and physicians emphasize compassion and well-being. Exemptions honor the body's needs. Faith and reason work together. A beautiful support for women in every phase of life. The body's story. Why does it hurt? Each month your body prepares for pregnancy. The endometrium becomes rich with blood. If no pregnancy occurs, your body sheds the lining as menstrual blood. Hormones, especially estrogen and progesterone, guide this rhythm. Pain often comes from uterine muscle contractions, called cramps. Prostaglandins rise before your period and can intensify cramps. Cramps may radiate to the lower belly, the back, even the thighs. They can feel dull or sharp and intense. Heavy bleeding means frequent changes and possible clots. Causes include hormone imbalance or uterine issues. If heavy bleeding or persistent irregular cycles affect life, see a doctor. Conditions like PCOS may be involved. The mind's journey, moods, feelings, and hormones. Emotions can shift before your period. Irritability, sadness, or anxiety are common PMS signs. Hormonal changes influence brain chemicals like serotonin and dopamine, affecting mood. Before menstruation, estrogen falls, progesterone first peaks, then drops. These shifts influence brain messengers, especially serotonin and GABA. Progesterone's metabolite, allopregnanolone, usually enhances calming GABA signaling. In some women, receptors respond paradoxically, raising anxiety, irritability, even anger. Differences in genes, receptor sensitivity, stress history, sleep, and nutrition shape reactions. This biology underlies PMS. In PMDD, these brain changes are amplified and disabling. You are not going crazy. This is a real biological response. Track symptoms. Patterns usually appear a week or two before bleeding and ease when it starts. For some, symptoms are severe. PMDD, disrupting work, school, and relationships. Seek diagnosis and treatment. Stress raises cortisol, which can worsen cramps and mood swings. Manage stress with light exercise, mindfulness, and rest. Small habits, big relief. Preparing and being kind to yourself changes the experience. Your emotions are part of the cycle and manageable with care. For some women, period pain is severe and debilitating. This may signal an underlying condition. Endometriosis. Tissue like uterine lining grows outside the uterus, bleeding and inflaming with no exit. It can cause severe pain, scarring, and fertility problems. Fibroids. Non-cancerous growths that may intensify cramping and cause heavy or prolonged bleeding. Symptoms depend on size and location, pressure, heaviness, heavy flow. PID. Infection of reproductive organs, causing pelvic pain, fever, painful urination, and possible infertility. Needs antibiotics. Adenomyosis. Lining grows into uterine muscle. Very painful, crampy periods and heavy bleeding. Symptoms often overlap. Proper evaluation and diagnosis are essential. Listen to your body. Know when pain is not normal, and seek care. There are gentle, effective ways to find relief at home. Heat relaxes uterine muscles and eases cramps. A warm bath with Epsom salts, if you like, soothes body and mind. Fuel your body. Fruits, vegetables, whole grains, omega-3s. Cut back on salt, sugar, caffeine, and processed foods. Hydrate and keep gentle movement to fight bloating and fatigue. Consider ginger, cinnamon, chamomile, and peppermint, but consult a clinician or qualified herbalist first. NSAIDs like ibuprofen or naproxen reduce prostaglandins. Starting a day or two before bleeding can help. One of the most established treatments for menstrual cramps is NSAIDs, such as ibuprofen. They lower prostaglandins and ease uterine contractions. Use as directed, with food, not for some people with ulcers, kidney problems, or certain asthma. Ask a clinician if unsure. For severe pain, hormonal therapies may regulate cycles, reduce bleeding, and ease pain. In rare cases, such as large fibroids or endometriosis, surgery may be necessary. Managing period pain is not just about the body. It is also caring for your mind and heart. Mindfulness and deep breathing create space between you and pain, bringing calm to your nervous system. If anger rises, step back, find quiet, reset your breath. Release energy safely, a pillow, a fast walk, or a workout if you're up to it. Talk to a trusted friend or therapist. It is okay to say, I need some space today. Cognitive behavioral therapy helps reframe thoughts and manage PMS or PMDD. If anger or relationship strain appears, counseling offers tools and support. Share needs with loved ones, help with chores, a warm hug, or peaceful rest. For spouses, patience, kindness, understanding. Support changes everything. Family can be a powerful source of comfort and support. Husbands, learn her cycle. Ask what she needs, childcare, a back rub, or a hot water bottle. Practical kindness lightens her burden. Sexual intercourse is not permitted, but affection is encouraged. Hug, kiss, cuddle. The Prophet, peace be upon him, showed tenderness with his wives during their cycles. Parents, teach daughters early, hygiene, self-care, and that menstruation is healthy and normal. Teach boys empathy and respect to build a supportive home. No teasing, no jokes about PMS. Choose compassion. While some discomfort is normal, know the warning signs. See a doctor if pain makes you miss life, or OTC meds do not help. Pain that worsens over time is a red flag. Seek help if soaking a pad tampon every hour for several hours, passing clots larger than a quarter, or bleeding beyond 7 days. If periods stop for over 3 months, not pregnant, consult a doctor. Urgent care for sudden severe pelvic pain, possible ruptured cyst or ectopic pregnancy, especially with fever, chills, dizziness, or fainting. For severe mood symptoms or thoughts of self-harm, reach out immediately. Trust your instincts. Getting help is courage. Your cycle is a natural rhythm and a decree from Allah, wisdom and mercy. Changes in worship are a gift of ease, not punishment. Some pain is common. Severe pain is not. Understand causes and advocate for care. Combine self-care with professional advice for wellness. Is it a sin to feel angry or sad during your period? No. Manage feelings and seek help if overwhelming. Why worse some months? Stress, diet, sleep, and prostaglandin shifts. Intimacy? Intercourse is not permitted. Affection is encouraged. Ground your journey in faith and sound medicine. Be patient with your body, kind to your mind, and lean on loved ones and professionals. Disclaimer: the content in this video is intended for educational purposes only and should not be considered a substitute for professional advice. Always consult a qualified expert for guidance specific to your situation. Write where you are watching from city, state, or country. Don't forget to like, share, and subscribe to stay connected with more inspiring content. Your support helps us reach more people and keep these important conversations alive. I'd love to hear your thoughts, questions, or personal experiences. Share them in the comments below. Your voice truly matters. Together, we can build a meaningful dialogue that benefits us all. Thank you for watching. May this video serve as a source of knowledge and reflection.